Start week 4 here. This is the upper extremity. And we're talking about the muscles, the arteries, nerves, and veins. And then we're going to end off by looking at some of the joints and the ligaments that help to secure those joints. So starting off with muscle, muscle makes up about 40 to 50% of the total body weight, which is tremendous. We talk about a lot of bone so far as we looked at the axial skeleton and appendicular skeleton. But most of the weight of the body, a lot of the functioning of the body will come from the various muscles throughout. The function of muscles is really to contract and shorten. As they do that, they help us to command motion, command flexibility, command mobility. And this is all through our voluntary or conscious command. So we can make decisions about the position of our body, about certain actions, movements, which we know are extremely important to our overall function. Some of the other functions of muscles would be to convert chemical energy into mechanical force. Again, moving body parts, maintaining our position, our posture, adjusting volume of hollow organs, things like the stomach, but also just the abdominal cavity, thoracic cavities, right? Our thoracic muscles, our abdominal muscles help to change the shape of some of those cavities. Other examples would be the bladder, blood vessels, which are controlled by smooth muscle. It's also going to help move substances throughout the body. Again, blood, intestinal contents through the peristaltic or contractile movements of those muscles. And then production of body heat. So when our muscles, particularly our skeletal muscles, when they contract, they actually contract and produce heat, thermal heat, which is a way for us to release some of that thermic energy as a part of our cellular processes. So really important different types of functions here with muscle. The three major types of muscle: skeletal, which is voluntarily controlled. This is in places like our muscles, muscles of the eyes, which are much smaller, more delicate skeletal muscles, and then big, bulky muscles like the biceps, triceps. And then we have some slow postural muscles like the back muscles, etc. So there's different types of metabolic, categories, but these skeletal muscles are all suited for movement. And then cardiac muscle found in the heart. This is also found at the base of some of our large vessels like the aorta. Up to the aorta wall will have some cardiac muscle. And the cardiac muscle is adapted for the contractility that we see with the pump that is the heart. Lastly, smooth muscle is found in our hollow organs, in our blood vessels, our intestines. A lot of our reproductive tract, our urinary tract will be lined with smooth muscle. Now, cardiac and smooth muscle are also called cardiac and smooth muscle are also called involuntary or involuntary muscle because they're not responsive to our voluntary command. They are going to be responsive to the autonomic nervous system, which is kind of the regulatory division of the nervous system that is under involuntary control. All right, now some important concepts to think about before we begin the discussion of muscles, talking about where they are, talking about how they move. We want to think about muscles of acting across at least one joint. So for example, the biceps, as we talk about the biceps, it's going to start at the shoulder joint, but it's going to cross the elbow joint. Thus, its action is going to help with flexion of the elbow as well as supination of the elbow. So muscles that we'll speak about usually suspend across at least one joint. Some suspend across two, which we'll talk about in the lower extremities, but most of them suspend across at least one. In that, we have a point of origin, which is the proximal attachment of that muscle. It's kind of like the anchor for movement. And then we have an insertion, which is the distal attachment for that muscle, which is generally located further away from that origin. So we have a point of origin, which is usually closer, and then a point of insertion, which is usually further away. But these are two attachment points across that suspension. And then a muscle will never push, it will always pull. This is why we talk about the insertion being the point of origin. That's the axis upon which that muscle moves. And so as the muscle contracts or shortens, it's going to pull the limb towards the origin. And as it relaxes, it's going to relax the limb away from that origin. All right. So the actions or motions that we will describe are going to be from that reference point of origin. Example, flexion being closing the joint, bringing the limb towards the origin. Extension being opening the angle at the joint, moving the limb further away from that point of origin. Right. And that'll make a lot more sense as we talk about some examples, as we talk about some of the origins and insertions of the muscles that we'll look at. Now, you don't need to memorize the origins and insertions, but they do help you understand the general position of the muscle and then, of course, its action. Now, extrinsic shoulder muscles, we're going to kind of start with the back and upper shoulder muscle, and we'll call these extrinsic because they're not actually found in the shoulder, but their actions do help to move the shoulder. So we'll talk about some intrinsic ones like the rotator cuffs, but these, although they are not acting directly on the shoulder, they do help move the shoulder more extrinsically. So the trapezius is one. This is a large diamond-shaped muscle. It's really superficial when you look at the back from a posterior view. And the action of this muscle is going to be acting on the head, acting on the shoulder, because of these attachment points, attaching to the occipital bone here, attaching to the spine of the scapula, and then attaching to the spinous processes of the vertebral column as well. So that's going to help give you an idea of how it acts, right? Acting in terms of flexion, acting to raise the shoulders because of those various attachments. Latissimus dorsi is another very large, very superficial muscle. This one is more of a fan shape as opposed to a diamond shape. And it is basically going from the lower spinous processes across the axilla to insert at the intertubercular groove. We're going to talk, we actually already talked about this landmark when we talked about the greater and lesser tubercle of the humerus and the intertubercular groove. So the latissimus dorsi goes under the axilla to go right into that groove, inserting on the shoulder. So that again helps to tell us how it will actually move the limb. It's going to be important in actions like hugging, like rowing, like raising yourself on a T-bar, those types of action that help to move the trunk close towards the body. So those are two extrinsic and superficial muscles. If we go a bit deeper, so take those layers off, we'll encounter the levator scapulae. Levator scapulae goes from the transverse processes of the upper cervical vertebra and then inserts on the medial border of the scapula. And as we can see, its action is going to be to raise the scapula towards the head. So really important in elevating the scapula or shrugging the shoulders. Next, we have rhomboid minor and major. And as the names would imply here, minor is a smaller muscle. It also happens to be above, major, much larger, and happens to be below. So both minor and major go from the spinous processes of the vertebra, the cervical and some of the upper thoracic, across to the lower medial border of the scapula, and its actions would be to help retract the scapula. So adduction of the scapula, bringing the scapulae together, which is being retraction of the shoulders. Right. Let's look at some of the intrinsic shoulder muscle. Again, that distinction between extrinsic and intrinsic. Extrinsic being outer muscles that happen to move the shoulder, intrinsic being actual muscles that are found within the shoulder joint. Now, these are going to be further divided into some that we call the rotator cuff because of the way that they secure the glenohumeral joint, the shoulder joint. And then we have some others that are found more externally, but still within the shoulder. So the supraspinatus, infraspinatus, and teres minor, the first three muscles here, happen to be a part of the rotator cuff. So those would be the supraspinatus, found in the supraspinous fossa. We discussed this fossa last week when we looked at the various surfaces of the scapula. So supraspinatus having the supraspinatus, or supraspinous fossa having the supraspinatus muscle. Infraspinous fossa below the spine having the infraspinatus muscle. And then teres minor is just inferior to the infraspinatus. So we can see the very edge of the teres minor here. And these three, 1, 2, 3, also help to form the rotator cuff, but are considered intrinsic shoulder muscles. Now, continuing in that order, we have teres major, major being much larger and below the teres minor, as well as the deltoid. Deltoid being the outermost muscle covering up most of the shoulder joint itself, also covering up most of the intrinsic shoulder muscles. It's also going to be attaching to the spine of the scapula posteriorly and the clavicle anteriorly, and then inserting on the tubercular groove or the deltoid groove, excuse me. Sorry, the deltoid tuberosity. Deltoid tuberosity being the landmark on the humerus for the attachment of the distal edge of the deltoid. So those are some of the intrinsic muscles that we have posteriorly. The other two, the pectoral muscles, which would include the serratus anterior. Now, serratus anterior is going to be lower along the rib cage. If you think about the name here, serratus, which means like a serrated knife, which has that jagged edge, that is the exact way that serratus anterior will insert onto the ribs in sort of an interdigitated or serrated fashion, creating these jagged edges. So this is serratus anterior, which is one of the pectoral muscles. Let's look more closely at the rotator cuff. The rotator cuff are 4 shoulder muscles that help to secure the glenohumeral joint. And if you think about the way that they actually strap the humerus into that joint, the head of the humerus into the glenoid cavity, they kind of act like if you had your fingers wrapped around the humerus, the very same way we see in the image here. So these 4 muscles, subscapularis being the anterior most, supraspinatus being the superior most, infraspinatus, and then teres minor, in that very order, these muscles, help to anchor the head of the humerus very securely into the glenoid cavity and maintain the integrity of the shoulder joint. So supraspinatus above, infraspinatus below, teres minor, excuse me, guys, getting a little congested. All right, so teres, all right, give me a second here. All right, so the teres minor being the lower muscle and attaching at the lower border of the head of the humerus, and then subscapularis being the more anterior. Okay, so that will help you remember the location of each of those muscles and then how they come together to form this rotator cuff. If we look more posteriorly, we can get a better view of those muscles, the supraspinatus and the supraspinous fossa, spine of the scapula being the border, separating those 2 spaces, infraspinatus and the infraspinous fossa, teres minor just under the edge of infraspinatus, and then subscapularis being in the subscapular fossa, which is more anterior. Okay, and then notice how they attach the greater tuberosity. So the greater tuberosity is the attachment for these 3 muscles, whereas the lesser tuberosity is the attachment for subscapularis, okay? Notice how subscapularis is best seen anteriorly because it's in the subscapular fossa, as opposed to the other 3, which are in the posterior scapula. Right. Let's shift gears and look at the posterior compartment. The posterior compartment has basically one large muscle, the triceps brachii. And the name would help you understand, right? There are 3 heads to this muscle, and it's attached to the arm. Brachii meaning arm, triceps meaning 3 heads. So there's the long head, the lateral head, and the medial head, which is deeper here, all attaching to the arm and helping with extension of the arm. So really acting across the elbow joint, but helping to open up the elbow joint or bring the posterior forearm closer to the back of the arm itself, right? Extension at the elbow. And if you look at the triceps, it's going to be taking up the entire posterior arm. So inserting onto the olecranon, which we talked about last week, it's going to help to open up that olecranon and engage it into the olecranon process of the humerus. Now, going back to the anterior view, we talk about one pectoral muscle. Another is the pectoralis major. And pectoralis major is attaching at the clavicle, at the sternum, so the clavicle superiorly, the sternum medially, and then it's going to attach onto the humerus laterally. So it's going to help to move the humerus as well as the chest muscles. And then deep to pectoralis major, we have pectoralis minor, much smaller, going from the coracoid process of the scapula and attaching onto the ribs, in between those rib spaces. And then beneath the pectoralis minor is serratus anterior. So we talked about serratus anterior earlier as being one of those muscles that we can appreciate posteriorly, but also anteriorly. And it sort of interdigitates, creating that serrated edge that we mentioned earlier. Here's this muscle alone, creating that jagged edge as it inserts in between the ribs. Let's make our way down onto the arm and talk about some of the arm muscles. Now, the arm can be divided into muscular compartments, and these are separated by connective tissue sheaths that give these muscles sort of these separated compartments. So the anterior compartment is called the flexor compartment. It has three muscles that primarily bring about flexion across the elbow or bringing the forearm closer to the arm and closing the angle at the elbow joint. The posterior compartment has one muscle that primarily does extension, which is the opposite action, opening up the elbow joint and bringing the forearm away from the arm. So the two compartments here, we can see how they're functionally different as well. The muscles that are found there are going to bring about different types of actions. Let's talk about those three muscles in the front and then the posterior muscle. Now, the three flexors are the biceps brachii. And the prefix biceps here helps us understand there are two heads, one attaching to the coracoid process. This is the short head of the biceps brachii, one attaching into the intertubercular groove to attach at the glenoid, which is the long head of the biceps. Okay, and don't let the appearance here fool you. I know the long head appears short. Excuse me, that long head appears short. The short head appears long, but that is because of the glenohumeral ligament that's sort of obscuring the full extent of the long head. Okay. The coracobrachialis being the deeper muscle here, attaching to the coracoid process, hence the term coraco, and then attaching to the arm as well. Coracobrachialis is going to be pierced by the musculocutaneous nerve. We're going to talk about this nerve later on. It's going to innervate all three of these muscles, but it's going to specifically pierce through the body of this muscle, coracobrachialis. And the third muscle is deep to the biceps brachii. If we take off the biceps brachii, we can much better appreciate it. The brachialis muscle, which is laying right at the humerus, right across the arm, and running across the elbow joint as well. All three of these muscles are going to help to flex at the elbow joint. And here's a much better view of that coracobrachialis once we take off the short head of the biceps. And then notice the tendon of the long head here. So notice how it goes all the way into the glenoid cavity, into the shoulder joint. Hence, the head of this, the tendon that is much longer, which is why it's the long head of the biceps. Let's move down into